The human body has been designed to resist an infinite number of changes and attacks brought to it by the environment. Maintaining health is a duty for everyone, or else we wouldn't be able to have that sound body in a healthy body. Remember, the ultimate fashion statement any woman can make is to have a fit body. So, stay healthy, eat well, relax, think positively, and always keep a smile on. Assalamu alaikum wa rahmatullahi wa barakatuh. You're welcome to another episode of the Cover Up Show, the show designed to demystify the personality of the Muslim woman, giving her a voice and celebrating her. I am Rahmat Wasim, your host. Cells grows in our body. We are all complex cells as we sit here. But sometimes these cells can grow out of hand. Some crowd out good cells, what is termed as good cells. And when this happens, your body refuses to function as it's supposed to be. And the doctors will tell you, you have cancer. This situation can occur at any part of the body. Be it the nose, the eyes, the skin, wherever it finds itself, it can decide to do that. Cancer of the breast is the most common cancer in both developing and developed countries, according to some research by some Ghanaian doctors. It is stated that 70% of the women who report on breast cancer usually do it at the later part of the stage in the disease, making it difficult to fight it, resulting in fatalities. Indeed, it has been stated that it is the leading cause of, in terms of cancer, cause of death in most women globally. Since breast cancer is a complex and a heterogeneous subject or disease, the best way to combat it is to understand what truly breast cancer is. Today we are talking on cells on Rampage, a conversation of breast cancer. We'll be right back after this commercial break. Don't go away. Welcome back, and Jazakumullah for joining us on the Cover Up Show, the show designed to demystify the personality of the Muslim woman, giving her voice and celebrating her. As usual, we have to say thank you to our sponsors and accessories. Alhamdulillah, we are blessed with the company of our sister and of our friend, Dr. Fuzaila Saaka-Dumba. She's a medical doctor at the Greater Accra Regional Hospital. She'll be helping us to understand what breast cancer is. Sister, you're welcome to Cover Up.
Thank you very much for having me.
Thank you so much, and giving the shots notice and all the getting lost before finding this place and finally here. Alhamdulillah. We want to understand breast cancer. But first, when we say the breast, what is it?
Okay, I'm sure we all have an idea what the breast is. The breast is basically the tissue that overlies the chest wall. It's usually from the second rib to the sixth rib. Then it may extend all the way to the collarbone or clavicle, and then
all the way there.
Yes. Then a part of it also extends into our armpits. That's what they call the axillary tail. And this particular part of the breast is very important to our discussion when we are talking about breast cancer. So I just wanted to note us to be aware that part of the breast extends into the armpit. And also because of in the women, the breast commonly specializes as a mammary gland to produce milk to feed the infants. And as women are growing, the breast tends to undergo various changes from puberty, that's the sprouting of the breast, to during cyclical menstrual changes that the breast has to go through changes. So the breast
perform a function of the menstruation, or
during menstruation, because of the hormonal changes, it affects the breast. So the breast also undergoes certain changes.
Sometimes it's some people have enlargement during their...
Yes, it becomes heavier. They may have some pain that relieves after the menses begins. Yeah, also during pregnancy, the breast undergoes changes again, as well as at the end during the menopausal stages. So you realize that the breast undergoes so many things, and all these changes that are occurring, and because of the various receptors that the breast has. It responds to these hormones, and all these may put it at risk of undergoing changes that may become abnormal in turn cause breast cancer.
Okay. So breast cancer is basically as a result of these changes that the which is a natural order that the breast goes through. Sometimes the cells that is coming in and going out can bring about bad cells. Is that what it is?
I would prefer to put it this way, that because of the various changes that the breast goes through, it puts it at risk of both benign and malignant changes. When we say benign, benign means that something may occur, a lump may be in the breast or something, but it is not harmful, as you said. Then the malignancy is the cancer. So these changes puts it at risk of undergoing all of these, and sometimes it may result in cancer. It doesn't always have to result in a cancer.
Okay. And breast cancer, is it only for the women? It's only women that have, because men also have breasts.
Yes, men also have
breasts.
They
might not be protruding and standing out there, but they also have breasts.
Exactly. Anybody who has breast can get breast cancer. It's just that the women are at a higher risk of getting breast cancer, because, as I said, it's because of the increased estrogen in our bodies that tends to make the breast enlarge, and as it undergoes all these changes, putting it more at risk of having breast cancer. So it's rare, but a man can also get breast cancer.
I see. In your course as like going up about as a medical doctor, have you ever had a situation of a man having breast cancer?
I've seen it once when I was a medical student at Konfanoche Hospital. So it's possible for a man to have breast cancer. As I said, it's rare, but that doesn't mean that it cannot occur. So we must all be on the lookout.
Okay. Sometimes when women have children, the flow of the milk for the infant, as you rightly said, is one of the functions of the breast. Sometimes it doesn't flow, and it forms this hard thing in the breast. Sometimes it turns into sore. Are they also a form of cancer, or they are normal sore?
No, what you are describing is not cancer. What happens is that, as we say, during lactation, as you are breastfeeding the child, the more the child sucks, the more breast you produce. Some of the children tend to maybe suck one breast more than the other, so the breast milk becomes stagnant in the breast. So as it stays there, it gets infected, and so you realize that most of them will come with a fever aside the breast pain, and that's what we normally call lactational mastitis. And usually if it's drained and the person is put on antibiotics, it gets better. So that is not cancer.
Okay. Oh, okay.
Yes, that's
because I've ever seen one that it developed into a sore. I think that it burst. That side that was hard burst, and it became a sore. It wasn't cancer.
No, I think it was a bad abscess, because when it forms an abscess, it's supposed to be drained. That's like pus. So you are supposed to drain it from the body, out of the body. If probably the person stayed with it for
the baby refused to suck
for so long, and that is what might have caused it. But since I don't know the details of it, I can't tell. But with this information, I think it was more of a breast abscess
and not cancer. Okay, it's getting interesting. We'll like to pause here for a commercial break. We'll come back and continue our conversation on Cells on Rampage, a specific conversation on breast cancer. Don't go away. We'll be right back with Dr. Fuzaila Saaka-Dumba, medical doctor at the Greater Accra Regional Hospital. Look, before the commercial break, we've looked at. I thought the breast is just standing there and just putting in a bra for life, But we've gone deep. We've looked at its function, the impact of it when it comes to menstruation and changes in a woman's body, and the risk that it comes to it. Now we want to go straight into the causes. What could make the breast be cancerous, or for someone to have breast cancer?
Okay, basically the main cause of breast cancer is not known. But as we said, a cancer is abnormal cell growth. So anything in the body that puts you at risk of having this abnormal cell growth will be able to cause breast cancer. So we can't tell the main cause, but there are various risk factors. And these risk factors may include, for breast cancer, for instance, one of the major risk factors is age. The older you get, the higher your risk of getting breast cancer.
Tell me about it.
Hardly will you find somebody less than 20 years having breast cancer. Very few people may get it between ages 20 to 30, but usually that's just about 2%. And usually those people tend to have a family history of breast cancer, which means there's something in their family that is causing them to have breast cancer.
It's like hereditary.
Yes, let's just say family history. We'll get to that as another risk factor though. But then usually from after ages 40 and above, the risk tends to increase because you are getting older, and the probability of a mistake occurring during your cell division is higher.
That's the hormonal changes that we discussed earlier.
Yes. Yes. Then secondly, we'll talk about family history. As I just mentioned, there are some families that carry a gene. They call it the BRCA gene. We have BRCA1 and BRCA2 gene. So if it tends to run in the family, then they are at risk. Also on the family history, I would like to make emphasis on the fact that if you have a first degree relative, your grandmother, your mother, your sister, your auntie, who has suffered from breast cancer, then it means that your risk of also getting breast cancer increases. And interesting enough, if the men in your family tend to have prostate cancer, then it means the women in the family are at a risk of getting breast cancer. So that's where the whole family history comes in. Then we come to the hormonal factors that put people at risk of breast cancer. For instance, if somebody has no child, somebody is about 40, 45 years, has never had a child, she has a higher risk of getting breast cancer than someone of the same age who has children.
Why?
Because during pregnancy, you stop undergoing these cyclical changes of menstruation.
For about 9 months.
Yes, and after the 9 months, you are even lactating. You are giving the child breast milk. So within that period, you are not menstruating. So it all reduces your risk of getting breast cancer. And even breastfeeding longer also reduces the risk of you getting breast cancer. Also on the hormonal changes, we will talk about people who get their menses very early, less than 12 years, and the person is already menstruating. They are at risk. And also those who get menopause later, after 55 years, they are at, because they have a longer
for the
period of the longer period of these various changes that occur during the menstrual period. Another risk factor is increased fat intake, because when we take a lot of fat, our body finally metabolizes it into estrogens. So high fat intake, you realize that initially breast cancer was not common amongst blacks as much as the whites, but as time is going on and our diet is changing, the risk is also increasing amongst us. So, and alcohol intake, smoking, it all increases the risk of a person getting breast. And if you do any job that exposes you to radiation, it may increase your risk of breast cancer, just like it increases the risk of any other cancer.
Wow. How do you detect? What are the warning signs? What would let me know that I'm having breast cancer?
Okay, breast cancer is one of those conditions that we can say is a silent killer. In a lot of people, there may be no symptoms at all, which is why we advocate for the screening test, because you may have no symptoms. But sometimes, and also early stages, there will obviously be no symptoms. And the person may feel a lump in the breast. Sometimes it's not only about feeling a lump in the breast, a lump or mass in the breast, but you may also feel that some parts of the breast has become much thicker than the rest of the breast tissue. Then it's also a cause
thicker as in
for
the skin is thicker or it's hard.
as we get to the examination, like when you feel it, the whole thing should be even. But if one side feels, it may be the skin or still inside, it may be difficult for you to feel a mass, but you feel that that side
is a bit different.
Yes, it's a bit different. Or even a change in the shape or size of one breast. Of the breast could all be signs of breast cancer for which you should investigate. Then if there's pain, but commonly breast cancer is not painful.
It doesn't present
with pain. Usually it's when it's really advanced or there's a type called the inflammatory breast cancer, which may be painful, but most of them are not typically painful. You may have some changes of the skin around the breast. There may be a rash, or you may have the change of the skin, which we call, it normally looks like the orange peel appearance. It's called peau d'orange. Like it looks like the skin tends to look like the cover of an orange.
Is it in terms of the color or in terms of how
the texture?
How the texture the pores has opened out on it.
Yes, exactly. Exactly. That's also one of the signs, and usually that's also a bit advanced. So because it means that it has infiltrated the skin. Then you may have the nipple retraction, where it's like the nipple is being pulled inside. Yes, pulled back inside. It's also a sign of.
So instead of it sprouting like
out, it's rather going inside. What that means, there's something pulling it inside. You see. Then you may have a nipple discharge, most likely bloody, and even side that the person doesn't even squeeze it, and the discharge is just coming like that. That could also be alarming. And as I mentioned from when we were talking about what breast is, you may have a lump in the armpit. The fact that you said it extends into the armpit. Yes, because we have the axillary tail. So there may be nothing in the breast, but if you feel something in your armpit, it's also a sign. So you should get checked out so that we be sure that it's not breast cancer that is causing the lump in the breast.
How would you know this is late?
The examination, when we examine somebody's breast, there are various features that we look out for. I said rightly that the breast undergoes a lot of changes. Not everything is cancer. Not every lump in the breast is cancer, but there are features of the lump that will tell you that this is cancer. I don't know if the viewers are interested in knowing these features, but usually for a lump that is cancerous, it may be hard. The edges are irregular. You can't really that
is when you go and do the mammograph.
No, when you feel it,
you can tell with your own hands.
Your hands, yes. The edges will not. You see, something may be round, smooth. It's not like that. It will be irregular, and you can't really tell the exact shape or form that it is. And as I said, the skin. If the skin already starts going through those changes, I said, like the orange peel appearance, that's also a sign that it started to spread because it's already infiltrating the skin. Nipple retraction. That's because you see, mostly, as I said, it's normally no symptoms. So by the time you are picking up the symptoms, then it's already reaching somewhere. That's why we want to prevent. And also, when you feel something in the armpits, you can also even feel something along the collarbone. As I said, it also extends it. When you feel something in the armpit, we have lymphatics that drain the breast. So usually when it's spreading,
lymphatics are what?
In simple form, they kind of, would I say, drain dirty stuff from the body.
Doctors don't like speaking English.
Yes. So when you see, it's because that place is like the cleaning path that it passes
Okay.
through. When the cancer is spreading, it will go through there. And so you see that's when you feel the mass there. Those masses you feel in the armpit, it may not necessarily be breast tissue. Most likely it's the lymph node that is draining the breast. But as it's draining those cancer cells, then it increases in size.
Okay.
That's why it's also a sign of, so usually when it's going there, then it means that the thing is starting to spread.
I see. Now let's talk about the mammograph. There was this conversation that someone told me that the person went to do the mammograph and nothing showed, and a month after everything went way higher. I mean, she went and she was told that she has breast cancer and it's even advanced. What could have not make the mammograph pick it?
That's an interesting question. The mammogram is designed such that it works best for people who are more than 35 years.
Okay.
Usually when a patient is less than
But the
35
mammogram
years,
is
a form of X-ray that takes a picture
of the breast.
And mammogram has been a lifesaver, if I should say so, because it's able to pick up cancer cells even before the woman can feel a lump in the breast. It's able to pick it up at the very beginning, but with everything there are limitations to it. As I said, it works best for women who are more than 35 years. For women less than 35 years, we usually prepare the ultrasound, the ultrasound scan, because women who are younger, their breast is more dense, and so the ultrasound will penetrate it better than
the ultrasound. That's the one that we used to take
when you are pregnant.
Yes.
Okay. Yes. It's penetrated better and it works better for people less than 35 years. But when you are more than 35 years, then we go in for the mammogram. Yes, so the mammogram usually picks it early, but from the way what you are describing, it could be that this person has a very aggressive form of breast cancer. And most of these aggressive ones usually occur in people who are younger. As I said, for those who have a family history, if they tend to have the BRCA1, BRCA2 gene, then they have very aggressive breast cancer.
It multiplies so quickly.
It multiplies so quickly. I don't know if you heard about this, but there's this American actress, Angelina Jolie, who went to do a double mastectomy. She has removed both her breasts and they've put in artificial ones. And most people don't understand why she did that, but apparently her grandmother died of breast cancer. Her mother died of breast cancer. And I think she tested and tends to have the gene. So
she didn't even wait for it to come.
As I said, your mother has got it, your grandmother, it's killed them. 50% chance that she's likely to get it. But here in Ghana, we are not always fortunate. People may not even be able to afford to do certain tests, and they may not have the knowledge. So she has gone ahead to take out the breast, and they've put in this thing.
With this Angelina Jolie story, now we now can move into the prevention. I know I heard of breast cancer when I was that was like about 20 years ago, 20 or more, back in tertiary. There was Cancer Awareness Week, and there was this particular lady who always come and speak to us, this woman, I've forgotten her name, on breast cancer and all that. There's a lot of awareness. But in terms of prevention, what can the individual person do, the woman watching?
When it comes to breast cancer, I would say that early detection is the key to preventing breast cancer. Because, as we rightfully said, it's a very silent killer. So it's better to be on the watch. Because something like age, you are growing old, there's nothing you can do about your age. If it's in your family, it's not your fault. It's in the family. There's nothing you can do about that. What you can do is to reduce your fat intake from what we said.
Healthy
lifestyle. Avoid alcohol, no smoking. Then when we give birth, we should breastfeed the children. It all helps.
Breastfeed the children for 2 years.
Yes, it all helps.
In the Holy Quran.
Yes, it all helps to prevent such diseases. And even as I said, the more children you have, the lesser your risk of
Fuzaila, you have 10.
of it reduces your risk, all because of the hormonal changes. But as we said, what we can do is the screening. And one, you can do monthly self breast exam at home.
Okay.
And usually the right time to do it is a week after your menses.
Okay.
That time the breast is less voluminous and you can be able to pick up everything. You have to look in the mirror to look out for symmetry. I know that people's breasts are not equal size, but they are close. If you start to see that one is getting way bigger than the other, then it's alarming.
Okay.
Yeah, you look at the nipple, the skin, any changes, any rash that is on the skin, or any orange peel changes, the nipple, is it going inside, all these things before you even touch. And when you touch, you want to feel every part of the breast, including the armpit area, all the way up to the clavicle as well. You feel all this, and once you pick up anything, you go to the hospital. As I said, a lot of masses in the breast may not be breast cancer, but it's better to be sure than to be sorry. Yes.
Out.
So you see a doctor and then they examine further and see exactly what it could be. Then aside that, aside the self breast examination, from the time from about age 20 to 30, you can see a doctor every 2 to 3 years to have the breast examined by somebody who knows what he's doing, because the self breast, you may not be able to pick up certain things, but at least from age 40 you should go yearly for a doctor to check your breast. Then you also start doing the mammogram. From 35 to 40 years, you can just do a baseline mammogram and keep. Then whenever you do, we compare to the baseline mammogram. You do it yearly, and
that one will form as a standard. I mean, there's a change, you can tell it fast.
If there's any change, we can easily
detect it,
easily pick it up.
Dr. Fuzaila, thank you so much. We're grateful. I've learned so much. First, I always say the breast is a muscle. I've been told it's not a muscle.
It lies on the muscle.
Oh, okay. I see. We are in the month of October, and the month of October is Breast Cancer Awareness Month. Your final thoughts and your final message to the women out there.
Breast cancer is one of the leading causes of death in Ghana, and it's sad that for a disease that we can easily pick up early and do something about, even if it means cutting the breast to save your life, it's worth doing. There's so many
there are
people,
survivors.
Yes, there are lots of survivors. It's sad that young people sit down and watch for this disease to take away their precious lives. And this breast cancer is so important that a whole month has been dedicated to it. And so as young women, we should take care of ourselves, and the moment you pick up anything, you see a doctor so that they can rule out any malignancy.
Any malignancy, I just say what it means. Any problem that could cause cancer. Doctors don't like speaking English. Don't worry, that's my way of teasing my doctor friends. Sister Fuzaila, our friend, our doctor, we are grateful. Thank you so much for your insightful discussion. We are grateful. Dr. Fuzaila Saaka-Dumba is with the Greater Accra Regional Hospital as a medical doctor. Thank you so much. May Allah increase you in knowledge. Before we finally wrap up, let's acknowledge our sponsors quickly once again for helping us come to your home every Friday at 9 p.m. on Cine Plus. Jojo Herbal Clinic, your ultimate and reliable healthcare center. Insania Herbal Drug Center, producers of Mercy range of products. Mercy Cream, discover the secret of true beauty. Rami's Kids Home and More for the best in children clothing and accessories. Kikau Furniture, furnishing just as you want it. And Havel's Fabric and Modest Wear for the best in modest clothing. Ariana Huffington said that fearlessness is like a muscle, and that the more you exercise it, the more natural it becomes for you not to be afraid of whatever will come into your life. Breast cancer can be fatal, but with early detection, positive mindset, and daily dose of a good lifestyle, you would beat it. And there's life after breast cancer, especially when you have your breast cut off. There's life after it. You are a super, super amazing and beautiful woman. Let's do this again, same time, same place here on the Cover Up, the show designed to demystify the personality of the Muslim woman, giving her voice and celebrating her. I am Rahmat Wasim. Jazakumullah, and may Allah be with us all.